If COVID brought one good thing, which is hard to think that COVID brought anything good, is telemedicine, is that we are now changing the way we practice care to our patients. And I think many patients are loving it. They can sit in their own home, they don't have to go out, and they can access us and they can have all the care. I don't think that that's perfect for everyone. We still need to see people. We still need to examine you occasionally. We need to still have that in-person touch. I'm not saying that that will replace it all, but it's good to have both. It's good for you to have that opportunity that if you don't want to fly all the way to Boston to talk to me about your smoldering myeloma or your MGUS or your myeloma, you can access us through your app, through your computer, through your phone if you want, and still have that almost in-person communication with us. And I can envision care happening as part of our usual routine care. We can see you in person occasionally, but we can also see you virtually or by telemedicine, and you can go get your labs locally wherever you are, potentially get your next generation sequencing as a blood sample, not needing a bone marrow biopsy. And even the therapeutic approach could change. I can envision clinical trials coming to you instead of you coming to us. So potentially could there be a van with the chemotherapy unit there, and they come and deliver the care to you, especially with subcutaneous formulations, rather than us telling you you have to come and see us twice a week. And all of those innovations will happen because it's a way of thinking what is the best approach to care for patients. And I actually think that could potentially eliminate the disparity that we have. When we think about Black Americans or in general other people who do not access large academic centers, who do not access clinical trials, one of the biggest limitations has been they don't have the time to take time off from work to come and spend 4 or 5 hours at Dana-Farber so that they can get their chemo for a clinical trial or for even standard of care. Now think about, can we change that model? Can we flip it? And we come to them rather than they come to us. So I really hope that the future will be not only telemedicine, but also care, giving it to the patients where they live and not having to make them come to us.